Hello, dear patients. Today we are going to review the case of syphilis on legs. A woman came to see us. She had syphilis. By analysis, the diagnosis of syphilis was set. I'm not going to list what analyses were positive in her case. She did these analyses in dermatovenerologic dispensary and she was consulted by dermatovenerologist using a medical insurance policy. She was prescribed to do injections of ceftriaxone at home on her own, to do 20 injections. As a result of doing such injections, in about 12 days she had such acute inflammatory rashes appearing in the area of knees, and she was scared that it is syphilis that was undertreated. It was indeed undertreated, but she was afraid that these are relapsing syphilis rashes, and she came to our clinic. Syphilis has characteristics that are different from such acute inflammatory changes. However, the fact that doctors of dermatovenerologic dispensary, and I have seen the papers of this woman, officially prescribe with prescription of recipe the home treatment of syphilis by patient herself, induces huge stress in my father, who had been a head doctor of dermatovenerologic dispensary for a long time. Previously, such patients were isolated, injected at home. In extreme cases, there is an outpatient treatment of syphilis. But when a patient who is not at all a doctor or a medic is prescribed to do injections on her own from such a socially dangerous disease as syphilis, this makes doctors stunned. How is it possible? Therefore, it raises questions for me, and these doctors of dermatovenerologic dispensaries say that somebody treats syphilis in private clinics, etc. Have a look at what's going on. Is it right when a woman on her own does injections from syphilis at home? Did she do injection correctly or incorrectly? Was ceftriaxone right or not, etc.? There are a lot of questions. If there is a case of syphilis and you want to treat it on outpatient basis, then take this person for outpatient treatment. Invite her to do injections if you want that kind of abortive treatment scheme. There are a lot of questions for dermatovenerologic dispensaries about what they are doing and how syphilis can be treated at home on your own. This has always been a mystery for me. We will switch off from this paramedical problem and we'll have a look at what was done for this woman. First of all, reactions for syphilis were taken again, such as passive hemagglutination test, total antibodies, etc. There were no significant changes of indicators for syphilis, so she had almost the same reactions as before syphilis, as not much time has passed since doing last tests in dermatovenerologic dispensary. Also, after that, we took analysis for allergy and we found increased levels of eosinophiles and basophiles, which were quite significant. Sodium sulfate and intravenous ozone, calcium gluconate, antihistamine medications, sorbents internally were added for this woman, as well as external glucocorticosteroid ointments. Gradually, these rashes resolved. Ceftriaxone was continued, longidaza was added, as well as immune medications, as it is supposed to. This patient gradually finished the course of treatment. So these rashes were allergic, related to allergic reaction rather than syphilis. This allergic reaction was for sure increased by antibiotics, by injections of antibiotics, and it had to be corrected. This induced such worries in a patient ill with syphilis who was left for self-treatment by the doctors, because of which she came to the clinic. It is clear that later on she would have to do plant control analysis for syphilis, etc. However, as I said before, it is initially better for such patients who have to do long-term antibiotic therapy to take at least sample analysis from them, such as general blood analysis for allergy, even more so. Before the start of any self-treatment, I understand that today the doctors of dermatovenerologic dispensary do not need that. However, I say again that this raises huge questions for me. How is it possible to treat the patient at home if she can do injections from syphilis on her own? This is completely wrong. These are wrong contacts in the family during treatment, etc. Therefore, if the patient undergoes outpatient treatment, then at least he has to come for outpatient injections in dermatovenerologic dispensary in specialized institution. If it is necessary to diagnose and treat different skin lesions during different sexually transmitted and skin diseases, you can consult venerologists and urologists of our paid medical center of dermatovenerologic dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such diseases. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.